Hi, I'm Dr. Larson. So today I just want to bring your attention to a really common problem that is very manageable at pretty much all stages, and it's a really significant risk factor for cardiovascular disease like heart disease and stroke, and that's high blood pressure or hypertension. High blood pressure is a major risk factor for things like heart disease and stroke, and it can go on and on for a very long period of time without knowing it, because oftentimes there's no symptoms. Some people get symptoms of high blood pressure, but a lot of people don't. They just have no idea that they have high blood pressure until it's just checked on a routine evaluation, and they find out that it's way too high, way out of range. And so when the blood pressure is too high, that puts a significant amount of extra stress and strain on the whole cardiovascular system, and that can make everything kind of age faster and make it more vulnerable to injury and damage. And so this is why it's a risk factor for these cardiovascular issues. For example, it's a risk factor for strokes, and the reason why is because there's extra stress and strain on the cardiovascular system, and the brain is vulnerable to having these little blood vessels either burst or sort of clot up and become damaged. And so there's two basic sort of strokes. There's the type of stroke that where the blood vessel collapses or it gets clogged up, and that inhibits proper blood flow and oxygenation into that part of the brain, and that's called an ischemic stroke, which basically means lack of oxygen and blood flow to that part of the brain, and then neurons start dying and symptoms start immediately. That's probably about 85 to 90% of strokes are the ischemic type. And this doesn't just happen in 70-year-olds, 80-year-olds, 90-year-olds. This can happen in your 40s. So this is a really important problem to, first of all, find out. Everybody should know what their blood pressure is. It's such a common problem. It's a very manageable problem, and it can significantly decrease risk factors for these really serious, in some cases, life-threatening conditions. The other 10 to 15% of strokes are what are called hemorrhagic. A hemorrhagic stroke is basically where the blood vessel bursts, it pops open, and blood leaks into the neurons, and this causes damage to the neurons. And the symptoms could be the same, whether it's an ischemic stroke or hemorrhagic stroke. And I just wanted to make you aware of kind of the acronym that you should pay attention to if you start to experience, or anybody that you are with experience these symptoms. And the acronym is called F.A.S.T, F-A.S.T. And the F stands for facial drooping. If you notice that the face starts to droop, the A is arm weakness. If you notice, like you're writing or you're typing or something, you notice that your hand is just not working right, that can be a really key clinical sign that that you need to get evaluated as soon as possible. The S is for slurring of speech, and the T is it's time to call 911. It's time to get to the hospital absolutely as fast as possible, because the sooner that you get to the hospital, the sooner that they could start intervening with the problem. Either it's going to be an ischemic problem or hemorrhagic problem, and there's really great emergency medicine procedures that can be done to treat that very quickly. And the faster that you treat it, the faster that the neurons are going to be able to recover, because there's a decreased amount of damage. If this goes on and on, and you're kind of in denial, or you can't have somebody help you or whatever, these can get worse. So you want to pay attention to these symptoms, and they can oftentimes happen very abruptly. And so you want to get to the hospital as soon as possible. So remember, F.A.S.T, facial drooping, arm weakness, slurring of your speech, time to call 911 and get to the hospital as fast as possible. So those are a few key things that could truly save somebody's life. Hypertension is very treatable. There's pharmaceutical options, there's natural medicine options, there's diet lifestyle options. So there's multiple ways that blood pressure can be treated. And obviously we have more options if it's at kind of the mild, even to the moderate stage. As it gets severe, that gets closer and closer to only having pharmaceutical options, because there's maybe, you know, too much irreversible kind of effects that have to be kind of overridden by pharmaceutical medications. But oftentimes that's not necessary. Those are just for those later stage issues. For some of the earlier mild to moderate, very, very treatable with natural medicine. We've done that many, many times in our clinic, and it's something that you know, everybody needs to know what their blood pressure reading is, so that you can decrease this very manageable and very significant risk factor for cardiovascular issues. So hopefully, you know, usually I cite a study or something. Today I just wanted to bring attention to this very common issue that that I want you to, you know, be aware of. Get your blood pressure checked, get it checked regularly. You don't have to be obsessive about it. You have to get it every day or even every week, but periodically you want to have your blood pressure evaluated to make sure that things are okay. And then, you know, follow, get advice, whether you want natural medicine or pharmaceutical medicine. Get advice for what can be done to manage that if it's elevated. If not, good job. Keep doing what you're doing, and enjoy. So hopefully you learned something. Until next time, keep it real.